Many people assume that once they submit an SSDI application, nothing can be changed. Fortunately, that's not true. If you discover an error or have important new information after filing, you can often update your application, and doing so promptly may help prevent unnecessary delays or misunderstandings. Common issues include forgetting to list a doctor or hospital, leaving out a medical condition, entering incorrect work dates, failing to mention medication side effects, or forgetting treatments you've received. It's also common for applicants to receive new diagnoses, undergo surgery, have additional imaging or testing, or experience worsening symptoms while their claim is still being reviewed. Those developments can be important to your case. As soon as you realize something needs to be corrected, contact Social Security. If your claim has already been transferred to Disability Determination Services, you may need to provide the updated information directly to the disability examiner assigned to your case. When submitting corrections, be specific, organized, and provide supporting documentation whenever possible. If you're mailing or uploading records, keep copies for your own records and document the date they were submitted. It's also important to understand that updates aren't limited to medical information. Changes to your address, phone number, healthcare providers, or other information that could affect communication about your claim should also be reported promptly so you don't miss important notices or deadlines. The goal isn't simply to fix mistakes. It's to ensure Social Security evaluates your claim using the most accurate, complete, and current information available. Small omissions can sometimes become bigger problems if they leave decision makers with an incomplete picture of your limitations. At Disability Advocates Group, we work with clients throughout the SSDI process to help build a complete and well-documented disability claim. If you have questions about your SSDI claim, call Disability Advocates Group at 8007-882-095 for a free consultation, or see if you may qualify by using our free SSDI screener at ssdianswers.com. This video provides general information about SSDI. It does not constitute legal advice.